I work as the SURC clinical nurse consultant at the Olivia Newton-John Cancer Wellness and Research Centre. So that is the clinical nurse that works in the Symptom and Urgent Review Clinic, and that's a symptom management clinic for cancer patients having treatment in day oncology who might not feel well and have some symptoms that they need managed. My motivation for research or why I started doing research, I think, was because when I would speak to patients and there was a light bulb moment where they were like, oh no, this is my simple problem. And it was perhaps things as nurses we didn't even think about, or as anybody didn't think about, because it's almost so simple and so clear. And it was at that moment that I thought, oh, we didn't think of that, but if we had asked people, we would have got those responses and we would have got those answers. So I think that's the point where I think, okay, this is a good opportunity to do some research and to explore what's actually happening, because it's not always what you think it is. We often have all of these preconceived ideas about how things are, and it's not always the way it is. We're doing a research project at the moment looking at patient-reported outcomes in patients that have used SURC, so used the nurse-led clinic, and seeing if we've made any impact on things like health literacy, health service utilisation. And also we are in the middle of doing a project looking at how we deliver patient education. We are trying to develop some standardisation and give the nurses some of the tools and skills to be able to effectively educate and inform our patients before starting treatment. Some of the research that we've done in terms of organisational impact, we've been able to reduce the number of emergency department presentations made by our patients. We developed some of my research based on knowing that a lot of cancer patients come to emergency after receiving treatment. And so we wanted to look at what some of the risk factors might be. And so since then, we've managed to implement a model that targets patients that are more likely to come to ED than others. And that's shown a significant reduction in ED presentation, and as you can imagine, has made a huge impact on patient outcomes and the experience of having ambulatory cancer treatment.